1017 FM, 710 Keel. Robert and Aaron in the morning. Robert's on vacation. I got my buddy Dan Keel here.
Hey.
Joined by the Governor's Executive Counsel, Matthew Block from Baton Rouge, I assume. Good morning to you, sir.
Good morning, Aaron. Good morning, Dan.
Want to talk to you about the cooperative endeavor agreement between Ochsner Health and LSU. There were a lot of reports yesterday that this is a done deal, but it's still a little ways from being finalized, correct?
We're close. We have a couple of steps left to go, but I think we have a structure of a new partnership in Shreveport, Monroe that is going to make sure that we stabilize healthcare in North Louisiana, that we support the medical school, we keep it in Shreveport, that we give it the resources it needs to grow, and so that we can not only grow the medical school, but grow the hospitals, add additional programs and services there. So we have a couple of steps left. It requires approval by the LSU Board of Supervisors, which will be sometime, I think, next week. And then we will be in front of the legislature to give the legislature a report to the Joint Legislative Committee on the Budget, and then sometime, hopefully by the end of the month, there'll be a transfer from BRF to this new entity, this new partnership that's being created to run the hospitals.
What will we see locally in terms of changes, jobs, service?
I think, obviously, there's going to be a change in terms of the way the hospital is branded, and you're going to start to see some additional things being brought into the hospital. I don't think the employees are going to see any real difference, and that's one of the things that we've talked a lot about with Ochsner coming in. We wanted to make sure the employees were protected. We wanted to make sure that their 401ks, their health care, all of that was going to be able to continue, and that's been a big part of these discussions, and something that we're happy to say that is going to be able to continue in the same way it was before. But I think the main part of this is not really what you're going to see on October 1. The main part is what are you going to see a year from now, 5 years from now? Because a big part of this from the very beginning is the discussion has been about what is the strategic plan for growth and for additional support and for additional resources to come in with Ochsner's participation in these two hospitals. And so I think you're obviously going to see a big presence from Ochsner in the North Louisiana community that is going to provide a lot of additional opportunities for world-class healthcare in North Louisiana. I think it's something we're all going to be proud of.
There were some letters flying about the appointment of Steve Scrivanos. It looks like that dust is settled.
I think so. Look, this has been a long discussion over years about what is the best way to do this, what's the best way to create buy-in from the community, and what's the best way to make sure we have a board that looks like North Louisiana, that is represented by North Louisiana. And obviously one of the discussion points has been what sort of participation there will be from BRF in this new entity. I can tell you what the agreements that are being finalized right now. It will call for a termination, and it will terminate the existing CEA by BRF. However, there will be initially there's going to be a board spot that will be occupied by Steve Scrivanos. He will be one of the Ochsner appointees, and we are confident that this is something where a lot of the animosity and a lot of the challenges that have sort of defined this partnership from very early on, certainly before Governor Edwards took over, but that have continued for the last 2.5 years. We're hopefully looking at the start of a new day here, and I think we are. I mean, this is a historic partnership. It's going to look very different than any other partnership that we have with the other partner hospitals throughout the state, and that it's a true partnership.
There's lots of concerns, especially by Senator Tarver here from our area, about the debt BRF owes, that it is being forgiven. Is that accurate? What can you shed some light on that?
So sure, and I know Senator Tarver. I've spoken to him several times. I know he has some challenges with this arrangement. But one of the things that's happening is whatever debts, whatever receivables, in other words, money they have coming in, because it's still right now. If you go and drive by on Kings Highway right now, it's still a going operation being run by BRS. So they have debts that they have receivables that they are owed money, and so this new company is going to assume, this new partnership between Ochsner and LSU is going to assume both the debts and the assets and the receivables of the new company. So I understand he wishes this were being done differently, and I think if we were starting from a blank slate where we were creating this out of whole cloth, I'm sure there'd be some things that we would do differently. But this is sort of what we've come up with over a year as we've been working on this. This is something we've come up with that we think is the best solution to this, and it's something that I think you all are going to be hopefully impressed. Is in the entire Shreveport community, the entire North Louisiana community is going to be impressed by what this partnership will be able to bring into North Louisiana.
Is there a $13 million shuffle somewhere in that subject you were just talking about, that some money is going to come back to BRF?
So, as I was just talking about, the way this is, and this is not an agreement between the state, the Division of Administration, the Department of Health, this particular agreement that I just mentioned, because what this new company, that is this new partnership between LSU and Ochsner, is going to create a brand new company that is going to assume the receivables, the income coming in from BRF, and it's also going to take care of the liabilities. So as part of that, this new company is buying that from BRF. So that's where that money's coming from. This is not a payment from the state to BRF, but this is going to be something where it's part of the transaction. And look, it's a complicated deal. There are a lot of moving pieces to it.
Is there a name yet?
Yeah, I think the name is going to be OLSU, and I'll leave the branding folks and the marketing people who are going to be coming in and making sure that it is a unique and noticeable organization that's going to come in. I'll leave it to them to how they're going to talk about what their message is going to be, what their branding is going to be. But I think that's what we've talked about, OLSU.
Matthew Block, how long is this deal? What's the term?
So it's a 10-year deal, and that was one of the things that we realized early on, that if we were going to have this sort of long-term planning that really needs to happen, and frankly didn't happen when this partnership was first created. This was done fairly haphazardly in the previous administration when these deals were put together. They were put together quickly, not a whole lot of thought as to what these deals would look like 5-10 years down the line, and what the hospitals and the healthcare opportunities would look like 5-10 years down the line. And as you might remember, there were even blank pages in some of these documents when they were first approved during the Jindal administration. We weren't going to do it that way, and we wanted to make sure this was done transparently. We wanted to make sure it was done thoroughly, and it's taken us a while. And this is something where it obviously involved LSU, and involved Ochsner, and involved BRF, and obviously a significant amount of participation from the governor's office, from the Division of Administration. And so we settled on a 10-year deal because we thought we don't just want to focus on what this deal in these hospitals are going to look like in October. We want to focus on what are they going to look like in October, in 2025, in 2030. And so by giving Ochsner, by giving LSU that 10 years of stability, we are confident that we can allow for the growth and the planning that needs to be done to make sure that we have the opportunities for health care that we need.
Matthew Block, the Governor's Executive Counsel, thanks for your time this morning.
Thank you for having me on. I appreciate it.
You bet.